Argentina's President Javier Milei, a known admirer of Donald Trump, has announced Argentina's withdrawal from the World Health Organization, WHO, mirroring Trump's previous action. This decision, announced on Wednesday, has sparked immediate backlash from opposition parties and health organizations, who warn of severely diminished access to crucial funding. The ramifications extend far beyond immediate financial concerns. The move jeopardizes Argentina's ability to effectively combat public health crises and maintain essential healthcare infrastructure. Milei justified the drastic measure on social media, declaring the WHO a harmful organization responsible for executing the largest social control experiment in history. This statement, devoid of concrete evidence or specific examples, fueled further controversy and highlighted the deeply divisive nature of Milei's decision. The lack of transparency and disregard for established procedures only intensified the criticism. The legality of Milei's unilateral decision is heavily contested. Experts like Juan Gabriel Tecatlian, a professor of international relations at the Universidad Torquato di Tella, emphasize that Argentina's relationship with the WHO is governed by existing legislation, requiring congressional approval for any withdrawal. This legal oversight underscores the potentially illegal nature of Milei's actions and raises concerns about the rule of law within the country. The lack of proper legislative process raises serious questions about the president's understanding of his constitutional responsibilities and undermines the democratic process. The absence of a clear and transparent legal pathway for such a significant decision further damages Argentina's international standing. Milei's spokesperson, Manuel Adorni, attempted to downplay the consequences, dismissing concerns about funding losses. However, this claim directly contradicts the assessments of reputable health institutions, including the NGO Soberania Sanitaria. This NGO, dedicated to enhancing public healthcare access, unequivocally stated that the withdrawal will severely hamper access to essential funding mechanisms for vital medical supplies and technologies. This includes impacting funding for critical healthcare programs dedicated to combating infectious diseases and improving public health outcome. The loss of these resources will exacerbate already existing healthcare inequalities and diminish the country's capacity to effectively address public health challenges. The potential consequences extend beyond immediate financial limitations, potentially leading to a decline in the quality of healthcare services available to the Argentinian population. The criticism extends beyond the immediate impact on healthcare. Congressman Gabriel Solano vehemently condemned the move, labeling Milei a total puppet of Trump. This assessment reflects a widespread sentiment that Milei's actions are driven by ideological alignment rather than national interest. The decision, therefore, is not merely a pragmatic policy shift, but a clear indication of ideological conformity, sacrificing national interests for political posturing. Milei's emulation of Trump extends beyond the WHO withdrawal. He has also announced intentions to withdraw from the Paris Agreement on climate change, further isolating Argentina on the global stage. Additionally, he plans to construct a massive 200-meter wire fence along the border with Bolivia, a costly and potentially environmentally damaging project primarily aimed at restricting immigration. This aligns perfectly with the populist, nationalist, and protectionist agenda that Trump promoted and now influences Milei. The project is also highly controversial due to its potential negative impacts on cross-border relations and potentially exacerbating already existing social tensions along the border regions. The sheer scale of this project raises concerns about its financial viability and its environmental impact, highlighting the lack of planning and consideration given to the broader consequences of Milei's actions. The parallels between Milei and Trump's approaches extend beyond SPA. Both leaders display a penchant for populist rhetoric, disregard for established norms, and a propensity for making unilateral decisions without proper consultation or legislative approval. These actions, far from being isolated incidents, are symptomatic of a broader pattern of authoritarian tendencies, undermining democratic processes and institutions in the pursuit of personal political agendas. Further compounding the issue is Milei's domestic policy, Since assuming office, he has implemented aggressive austerity measures targeting the state healthcare system. This includes the shocking layoff of 1,400 Ministry of Health employees in January, a staggering 30% of the vaccine directorate staff, and 40% of the HIV, hepatitis, and tuberculosis response team. The severity of these cuts demonstrates a complete disregard for the well-being of the Argentinian population and their access to. These layoffs will inevitably have detrimental consequences for vaccine rollout, disease prevention, and the overall effectiveness of the country's public health system. The consequences of these drastic measures will be felt most acutely by the vulnerable populations who rely heavily on these services, highlighting the significant ethical and social implications of Milei's policies. The drastic reduction in personnel within key directorates underscores the potentially devastating consequences for the country's ability to effectively combat infectious diseases and manage critical public health crises. This disregard for public health is a testament to Milei's prioritization of austerity over the health and well-being of Argentinian citizens. The severity of these measures raises serious concerns about the long-term sustainability and effectiveness of the Argentinian healthcare system. This decision directly contradicts the WHO fundamental principles of promoting health and well-being for all. The actions taken demonstrate a profound disconnect between Milei's leadership and the needs of the Argentinian people. The totality of his actions creates a complex and troubling picture of a leadership prioritizing short-term political gains over the long-term health and well-being of his nation.